it is difficult to hear that you or a loved one has been diagnosed with cancer. But Anderson Regional Cancer Center is right here to help.
Whenever you hear the words, "You've got cancer," the next thought that needs to come to your mind is Anderson Regional Cancer Center, because that's where you're going to get the best possible care here at home by people who care about you.
Anderson Regional Cancer Center is the only comprehensive treatment facility in the East Mississippi, West Alabama area, offering medical care for all forms of cancer, including breast, prostate, colorectal, and lung.
We wanted a comprehensive cancer center where we could administer compassionate therapy and be accessible.
One of the fortunate things about having such a close-knit center is the way that we're able to work as a team. I can pick up the phone and call any of the radiologists, surgeons, or my partners who are within a few feet of me.
I think one of the most important things that we provide is personalized care, in that all the doctors that are in this group now trained in Mississippi, grew up in Mississippi, and we know the people here.
The standard of care at Anderson Regional Cancer Center is on par with that of any treatment center in the United States.
The way we treat cancer here is based on clinical trials that have been done over the years at small centers, but mostly larger centers. And it's what we call the standard of care. So we want to ensure that the patient gets the same care here that they would anywhere else.
In Meridian, we have a large percentage of physicians who are actually trained in the state at one of the most nationally recognized clinical-based medical schools in the country.
We are on the cutting edge in terms of not only medical oncology, chemotherapy drugs that we can give. Our surgeons are some of the best trained surgeons in the country and have the most up-to-date expertise, and I'd put us up against anybody in the country.
6 major universities are using protocols or procedures that we've developed here in Meridian, Mississippi.
Through treatment and recovery, Anderson Regional Cancer Center focuses on what matters most: the physical and emotional well-being of the patient and the family.
Of course, once you've been diagnosed with cancer, that's the most important thing in your life at that time. And I try to treat every patient as if they're the most important patient to me, because they are.
There's not any aspect of your life that's not affected when you have that diagnosis. We've shifted the focus of most of the treatments where we try to get the right drugs, but try to give them on an outpatient setting. Even if that means, the patient may have to come 1, 2, 3, 4 days in a row to the clinic, but they can sleep in their own bed that night, as opposed to sleeping in a hospital bed.
It's not just a job, it's not just a healthcare facility, but we want them to know we really care about their needs and make sure they get what they need while they're coming here.
We built a team here that we call it family-oriented. Our job is to try to make them feel at home when they come here, but as far as the long term, we want them to have a good rest of their lives, because my goal in almost 80% of the cases that come here is to cure them forever and ever. Amen.
The depth of experience shows. All of the physicians, the nurses, and the support staff work closely together at Anderson Regional Cancer Center for one purpose: to help their patients.
Our heritage is of healing and of compassion, and the Cancer Center embodies that. The medical staff, along with the support staff and all the employees here, they take that to heart.
It's a known fact that Anderson's has a floor that has nurses who graduated from nursing school as far back as the 1970s. Well, for nurses to want to stay in one place that long must mean that the organization is correct.
Some of those nurses have been working since they got out of nursing school at the age of 18, and my goodness, that's 30 years ago for some of them. But it's not only their knowledge, but it's how they apply that knowledge to their patients and in the care that they give their patients.
And the nursing staff that have so much experience in managing patients with cancer that they can read the patients. They can tell me a problem before I even see the patient.
The services offered at Anderson Regional Cancer Center include support groups, an information resource center, and even a dedicated computer for cancer research.
When you get that diagnosis, you are scrambling to get as much information as you can.
They had the vision for building the cancer center, of having a one-stop shop, if you will, where they could get treatment, chemo and radiation in the same facility. They cared enough to want to look out for what was best for our patients. We also have a resource room here at the Cancer Center, and it is also sponsored by the American Cancer Society. We have wigs, hats, turbans that have been donated.
No matter what happens, we did our best. We made the patients feel better, we cared for the patients, and we helped them in whatever way we could.
It's the philosophy of compassionate, personalized care combined with the latest technology that makes Anderson Regional Cancer Center the best choice for treatment, right here at home.
We can provide world-class cancer treatment center close to home, where you don't have to worry about the travel. You have the support of family and friends, and all of that is done locally by people that you can know and trust and that know you.
That's where the individualization of therapy comes in, the personal therapy for that individual patient. Some people can't cope with dealing with significant disease, in particular cancer, unless they have looked in every way that they can to be their doctor, is to give them advice, and ultimately I think it's our responsibility to do so.
Think about it, when you get told you have cancer, it's like somebody took a 2x4 and smacked you in the forehead. So you're not thinking that straight. You're just like, bam, oh, I've got cancer. And that's all you can think of, because that's all in your head. I've got cancer, I'm gonna die. Well, we have to kind of insert ourselves into that process and say, yeah, you have cancer, but we're going to do what we can to keep you from dying. We're going to do what we can to get rid of this. And here's how we can help you do things. And I think it's important that we do that.
Anderson Regional Cancer Center, heritage, healing, improving life.